Children living in two of Cincinnati's poorest neighborhoods.
Walter Smith Randolph shows us what's working as part of our ongoing series, Childhood Poverty, Cincinnati's Crisis.
From Local 12 News.
The disparity for hospital stays for children in Cincinnati's 52 neighborhoods is dramatic. Here in Avondale, children are 5 times more likely to have a hospital stay than kids living in Hyde Park.
We think one of the main roots is poverty. I think there are several challenges that many neighborhoods in our own backyard face that predispose certain children, certain families, certain households.
That's why Dr. Andrew Beck and social worker Kristy Anderson are working to reduce the amount of time Cincinnati kids spend in hospitals.
We need to, address where our families are. They are living in poverty. That then it impacts their trajectory of where they're going to go. Are they going to complete school? Are they going to get jobs? Are they going to have healthy lives?
To reduce the rate of hospital stays, Anderson and Dr. Beck focused on specialized care for children living in Avondale and Price Hill. The two neighborhoods have similar rates of hospital stays for children. The approach is threefold.
We've been able to engineer our system such that whenever a child from Avondale or Price Hill is hospitalized, a multidisciplinary team hears about it in real time and is able to think about what might have been preventable so as to learn for future cases.
That's on the inpatient side. On the outpatient side, some parents are now connected to support services.
Just like community health workers, social service agencies, legal aid supports.
Then there's also community outreach. 2 weeks ago, we told you about the Care Families Reading Bear group, which strives to increase literacy rates. Anderson says reading is connected to healthy living.
We get a child ready and excited to read, then they're ready to go to kindergarten. Then they will succeed. They will complete the 3rd grade, the promise. They'll go to, and they'll have an increased chance of graduating, then jobs, and then you can just see how the trajectory gets them on a path where they will be successful, and all of those things impact your ongoing health.
Which can then break the cycle of poverty while also decreasing death rates. Anderson and Dr. Beck say expect to see more programs like Reading Bears to address the health disparity. Dr. Beck says the work can't stop here.
We also must think about what drives those huge differences between Avondale and Hyde Park to begin with. And I think unless we do both, we're going to keep chasing our tails.
In Avondale, Walter Smith Randolph, Local 12 News.